Hello, everyone. Thank you again for joining us today for our virtual Open Enrollment Fair session. During today's session, we will go over spending accounts with ASI Flex. Before we get started, I would like to brief everyone on a couple housekeeping items. All attendees are muted and will be muted throughout the presentation. If you have a question, please type it in the chat box located on the lower of your lower screen or your monitor. All questions will be answered at the end of the presentation. Be informed that if you have a question, please type it in the chat box, and be reminded everyone attending the session will not see your question or your name. If you have a confidential question, please contact the Benefits Division directly. Lastly, today's webinar is being recorded. A copy will be posted on the Benefits Open Enrollment website. At this time, I will turn it over to our presenters, Katie Price and Anita Spencer.
Okay, thank you. Welcome to the HRA and FSA presentation. So let's take a look at the plans that are offered by the county. First, let's talk about the HRAs. So what are HRAs? It's a health reimbursement arrangement. It is a year-to-year account where the county contributes to the plan with flex credits if you are not enrolled in a high deductible health plan or dependent care FSA. They contribute up to $5,000 per calendar year. So you use the account to pay for current year expected expenses, unused funds at forfeit at year end. The HRA pays after healthcare pays, or the healthcare FSA pays. There is a $550 carryover provision, which is combined with the FSA, which will go back into effect for the 2022 plan year. Currently with COVID and things like that, the county has allowed an uncapped rollover from 2021 into 2022. So all funds that are remaining in your HRA in this current plan year will roll over. But then after that, within that 2022 year, it'll just go back to that $550 carryover provision, which is an amount combined with the FSA if you're enrolled in that. So now let's look at the FSA. The FSA is a flexible spending account, which is a year-to-year account where you set aside pre-tax dollars to pay for current year expected expenses. You may enroll in any insurance plan. You do not have to enroll through the County of San Diego. It can be through a spouse. There are three types of accounts. There is the general purpose healthcare FSA, which is for deductibles, co-pays, office visits, medical, dental, and vision. An important thing to keep in mind is you cannot be enrolled in the HSA, which is the health savings account, as well as that general purpose healthcare FSA. So that's where the limited purpose healthcare FSA comes into play, to where you can enroll in the HSA as well as that limited purpose. The limited purpose is for dental and vision expenses only. And then the third type of an account is the dependent care FSA, which is for daycare, after school care, preschool, and nursery school. If you would like to enroll in the FSA and the county then puts the money into the HRA, that FSA that you are contributing to will pay first, and then the HRA will pay last. And then remember that it is uncapped rollover in all of these accounts. So any of the FSA as well as the HRA from 2021 into 2022 for healthcare and dependent care, as well as the HRA and the limited purpose. So all of them for this year will carry over an uncapped amount, but then in 2022, it's going to go back to just the $550 will roll over for the HRA and FSA, and then there will be no rollover for dependent care. So how does the FSA work? First, you estimate the expenses that you know you will have that year. Then you make pre-tax contributions. You incur eligible expenses. You submit the claim to ASI Flex, and then you get reimbursed. So it is an IRS regulated program. For the FSA, you must re-enroll every year with a new election. You must spend all the funds during the year. Expenses must be incurred during your period of coverage or plan year. You do not have to be covered under the county's health plan. You can use the account to pay for your spouse or any of your dependent children, regardless of whose insurance they're on. The election for the FSA will remain in effect for the plan year unless you experience a qualified status change, which are things such as marriage, birth, death, and divorce. Funds remaining at year end are forfeited, but remember that you do have that 550 carryover, which is combined with the HRA. And then, of course, this year for 2021, there is uncapped going into 2022. But then after that, it'll go back to normal 550 carryover. So how to avoid forfeitures? It's easy. You can plan for predictable and recurring expenses that you know you will have incurred during the year. You can review prior year expenses as a guide to see how much you spent last year, which would be a good indicator of how much you may spend this year. Be conservative, so always start out with a smaller amount until you know for sure that you will be using that amount that year, so you don't face possibly losing money at the end of the year. You can use some tools online at www.asiflex/sdcounty. On this website, there is an expense estimator, which will help you to estimate how much to set aside. There is a list of eligible expenses. There are links to the FSA store, which is a great resource for over-the-counter products to see which are eligible without needing to submit any other type of documentation. And then remember, you can carry over up to 550 combined with the HRA after the 2022 plan year. So let's go a little bit further into detail on the healthcare and what items are eligible. So the maximum for the healthcare FSA is $2,750. And all of these expenses are also eligible under the HRA. So they are things such as prescriptions and office visit copays, deductibles, x-rays and lab, hospital expenses, mileage to and from healthcare providers, over-the-counter items such as sunscreen, braces, first aid supplies, pill holders, blood pressure monitors, diabetic supplies, drugs and medicines, as well as menstrual care products and PPE. Vision exams, eyeglasses, prescription sunglasses, contact lenses and solutions, reading glasses, LASIK eye surgery, dental exams, x-rays and fillings, orthodontia, crowns, bridges, dentures and adhesives, as well as dental implants. And then hearing exams, hearing aids and batteries. These are all eligible for the healthcare FSA as well as that HRA. So now let's look at the limited purpose healthcare FSA, which is the HSA compatible plan. So the maximum for this plan is $2,750, and they include dental and vision expenses. So vision exams, eyeglasses, prescription sunglasses, contact lenses and solutions, laser eye surgery, dental exams, x-rays, fillings, orthodontia, bridges, dentures and adhesives, and dental implants. This is a list of over-the-counter items, and I had mentioned earlier that you can go to the FSA store, and that is just a nice tool where you can purchase items through the FSA store, but you definitely do not have to purchase items through them. You can go to Walmart or Walgreens or wherever you shop and purchase items that way as well. And then you will just submit that merchant receipt to us that shows the items that you purchased, and then we can reimburse you off of that receipt. Effective January 1st of 2020, the IRS made menstrual care products as well as PPE, which include hand sanitizers, masks, sanitizing wipes, as well as home testing kits. And then also for over-the-counter items, it used to be that you had to submit a prescription. That has went away as well. So things that are medicated, such as Tylenol or cold medicine, eye drops, laxatives, those are all now completely eligible without needing anything else. The FSA store is a great tool because you can look and see which items are completely eligible, but you do not have to purchase through them. Okay, Anita, do you want to go ahead and answer some chat questions?
Yeah, we have a couple of questions here. A couple of these I think Katie has answered. One person asked if orthodontic care is included as a dental expense under the limited purpose FSA. And as you saw from the slide a couple of moments ago, yes, orthodontia is an eligible expense under that limited purpose healthcare FSA. And then someone is asking about how do we claim for over-the-counter eligible expenses. And in just a couple of moments, Katie is going to go through the claim submission and filing process. But basically for over-the-counter, very simple. Most of the merchants print out the receipt, and on that receipt is usually some type of an indicator as to what expenses qualify under an FSA or an HSA. So just always hang on to that merchant receipt because that's going to tell you that. And then you simply fill out a claim form and submit that receipt with your completed claim form. And then I have a couple of questions related to the slides. So Nedra, someone is asking if they can get a copy of the slides. And then another person is wanting us to show the slide once again on how that reimbursement process works. So perhaps we could share those slides with employees afterwards.
That would be fine, but also a copy of the presentation will be available on the Open Enrollment website, on the Benefits Open Enrollment website. So
Perfect.
The slides will be included with that.
Okay, and then carrying on with the over-the-counter store receipts, how specific does it need to be? Well, most of the receipts are the same. It shows the store name, for example, Target, Walgreens, Walmart, for example. It shows the date, which is key. It shows a brief description of that product and the dollar amount. So it needs to have all of those components. And then, as I said, there's always an indicator. I think Target uses a little plus mark. Walmart uses the letter H, meaning healthcare. Walgreens, I haven't been there in a while, but I think they used to just literally say FSA on the receipt or medical expense. So once you shop, you'll see some examples of those. Here's an interesting one. Are baby diapers a valid expense under the healthcare FSA? In general, no, diapers are not an eligible expense. Now, you do want to take a look at the website. That's asiflex.com/SD county, because in some cases, if it's for example, an adult who is incontinent, then diapers would be eligible, but not for regular care of a newborn baby. Here's a good question. Is there an option to have an FSA debit card instead of submitting claims? We do administer debit cards. I believe because of the county funding process, they have not elected to incorporate a debit card at this time. However, the claim filing process is very simple. And what I would recommend is for each of you, if you haven't done so already, be sure and download the mobile app, because that makes it so simple. You can simply snap a picture of, let's say you're in Walgreens, you're picking up some eye drops or sunscreen. Just snap a picture of that receipt and you can submit your claim very quickly right through the mobile app. So simple. Another one, vitamins, are those eligible? There is one type of vitamin that's eligible, and that is prenatal. Otherwise, vitamins that you take just for your general health on a day-to-day basis would not be in eligible expenses. Well, you have a lot of good questions coming up here. For an eligible service in 2020, can they still file a claim for that Katie, you may know the answer to that. I'm not sure what their run out period is from
So
2020.
for the 2020 plan year, yes, you can still file a claim for that. The claims filing deadline for the 2019 as well as 2020 were both extended due to COVID. So they are both March 31st of 22 or 60 days after the end of the national emergency, which of course we're still in that national emergency. So right now it's expected to be March 31st of 22.
Okay. And then someone here said they received a debit card from ASI Flex back in 2017 and wanting to know if they can use that. If that is a card from another employer, no. And keep in mind that the county does not have debit cards as part of the FSA program. Another question on sunscreen, is it eligible if we purchase at Sephora? It depends on the type of sunscreen. So what I would do is ask the people at Sephora where you're purchasing. To my knowledge, those are not eligible. It has to be at least 15 SPF and broad spectrum. So I'm not so sure that those products meet that criteria. And then someone asked about the form that needs to be submitted to file claim expenses. That is online, so asiflex.com/SD county. And if you go under the resources tab and click forms, you're going to find claim forms. And I think that is all the questions we have so far, Katie.
Okay, so let's go ahead and move into the dependent care. So the dependent care, the maximum for the plan year is $5,000. It is $2,500 if married and filing separate income tax returns. The $5,000 is a household maximum. So if both you and your spouse both work for the County of San Diego or an employer that also has the dependent care, you can both do $2,500 or whatever combination, but that $5,000 is a household max. So the dependent care is for expenses for babysitting while you work, preschool or nursery school for young children, before school or after school care, day camps, and then adult care for people who are unable to care for themselves, who are 13 and older. So claim filing options, let's go a little bit further into that. There are multiple claim filing options. You can, once you are enrolled in the program, you will get a confirmation letter, and at that point you know that you can set up your online account detail, in which you'll establish a username, a password, and a security image, and you can submit your claim online through your account detail. There will be no claim form that you have to submit with that. You'll just need to scan in the documentation, and then you'll fill out the claim form electronically online. The next option is through the mobile app, in which you'll just take a picture of the documentation, and through the mobile app, it'll be the exact same username, password, and security image that you had established for your online account detail. And then it'll just be an electronic claim form that way as well. So you can just snap a picture if you're in the pharmacy or the doctor's office and submit the claim right then and there. And then the other two options are faxing and mailing. For those, you will have to get a claim form off of our website, which is just www.asiflex.com/SD county. And you will have to complete that claim form and then submit the documentation if you would like to fax or mail. And then you do not have to use any one of these options. You can do multiple if you would like, completely up to you. A new feature that we're very excited about is the FSA Store cardless pay feature. And you can do this through the mobile app as well as online through your account detail. And basically it provides payment to the FSA Store directly from your ASI Flex account. So either the HRA or the FSA. So how do you do it? It's easy. You can sign into your ASI Flex account either through the mobile app or through your online account detail. You then click on the link to shop at the FSA store from your account detail. You'll select the over-the-counter products that you wish to purchase, and all of the items at the FSA store are completely eligible. And then you proceed to checkout. And at that point, you would select the ASI Flex payment option, and then the funds are taken directly from your account and paid to the FSA store, and then the items are shipped to your home address. So the ASI Flex mobile app is completely free. There is a video tutorial on our website. You can use a smartphone or a tablet, and you simply just snap a picture of the documentation, and you can submit that directly from a pharmacy, doctor's office, dental, or vision office. You can also check your available balance 24/7. So this is a screenshot of your account detail where you can register to view your online account statement, read secure messages that are sent to you, as well as submit claims. And once you get that confirmation letter that you're enrolled in the program, you would just click create an account here towards the bottom. So claim documentation, I know there's been some questions on that, but the claim documentation must always include who, what, when, where, and how much. So who, for whom the service is being provided, what, a description of the service, where, name and address of the provider providing the service, when, the date the service was provided regardless of when paid, and then how much, the dollar amount that you owe. So going a little bit further into what type of documentation is required, if the expense is covered by insurance, you can submit the EOB or the explanation of benefits, or the itemized statement from the provider. So if you ask the provider for an itemized statement, that should include all of the information that we need to reimburse you. If the expense is not covered by insurance, you can just ask for the itemized receipt. For prescriptions, you can submit the pharmacy receipt, printout from the pharmacy, or itemized mail order receipt. And then for over-the-counter healthcare products, drugs, and medicines, you can just submit the itemized merchant receipt. Note that credit card receipts, paid on account, or balance forward statements, as well as canceled checks, are not eligible documentation. Be sure to go green. You can sign up for email or text alerts to avoid paper notices and delayed mail. You can have the payment sent directly to your bank and avoid the hassle of paper checks as well as delayed mail. And you can sign up for direct deposit as well as email or text alerts directly through your account detail and manage that at any point in time to where you can go in and update any information that you would need. You can use the FSA store cardless pay to pay for over-the-counter healthcare products. File the claim with the mobile app online. It's quick, it's easy, and it results in rapid claim payments. For dependent care, you can have the daycare providers sign the claim form, and then no other documentation is needed. This is an example of the website to where you can access several helpful videos, see a list of eligible expenses. We have an extensive frequently asked question section. So some online resources, which again, the website is asiflex.com/SDcounty. You can access your FSA account detail, review messages that are sent to you, manage your personal settings, including direct deposit, email, or text notification. There is an extensive eligible and ineligible expense listing. There are links to the FSA store, which have thousands of eligible FSA products. There is a list of frequently asked questions, an expense estimator, and tax savings calculator. So those are nice tools to help you decide on how much to set aside for the year. There are educational videos as well as IRS forms and publications. Some important dates is the claims must be incurred during the plan year. So the County of San Diego's plan year runs on a calendar year basis, so January 1st through December 31st. Incurred means that you have actually had the service provided or that you have secured the product that gave rise to the expense. The deadline to submit claims for the 2022 plan year is going to be March 31st of 23. Be sure to not wait until the last minute, as you may miss the date. This is all of our customer service information as well as our business hours. You can email our customer service email address. Our phone number for our customer service line, they are available 5 a.m. to 5 p.m. Monday through Friday, as well as 7 a.m. to 11 a.m. on Saturday. And I will leave that up. Anita, are there any other questions?
I have a few questions. I just also wanted to mention to you folks that when you sign into your account at asiflex.com, we also have a nice chat feature that's going to be available. So watch for that to come. We do have a few questions. One person's asking, if I signed up for a new healthcare FSA with $550, would that ensure that unspent funds are not forfeited at the end of the year? Yes, that's absolutely true. So for those of you who might be on the fence just a bit, knowing that you can always carry over that $550 might be a good time for you to consider signing up. But again, look at the eligible expense list. There are so many things that all of us use on a day-to-day basis, things that are in your medicine cabinet, for example, that you may not be thinking about, like your aspirin and Tylenol and different things like that that are eligible. Another question is COVID-19 testing eligible? Yes, that is an eligible expense along with other personal protective equipment, which includes hand sanitizers, certain wipes, for example, and face masks. Someone asked if they buy sunscreen during vacation in another country, lucky you, would that be eligible if they have a receipt to submit? As long as that product is legal in the United States, I can't imagine that a product would not be legal. But again, be sure that it is SPF 15 or higher and broad spectrum. It's critical that it meets those two criteria. Here's a question on the high deductible health plan. This person says they are on the high deductible health plan. They have a debit card from Optum, and that's through the health savings account, and they're wanting to know what items they can use to buy or not buy. I would suggest for you to look at your Optum website, but in general, health savings accounts includes all kinds of medical, dental, and vision care expenses. The other thing I would point out for you is that you are eligible for the limited purpose flexible spending account, which you could use to pay for dental and vision expenses. This person says, if I have $1,000 in the healthcare account and I don't use it all and it gets forfeited except for the carryover amount, who gets that money? According to IRS rules, since this is a self-funded program, that money goes back into the plan itself. So that means that it goes back into the plan, and typically what the county does is they use that money to offset administrative expenses of the program. Oh, here's a good question, one I love to answer. What's the turnaround time for claims to get processed? It's very quick. Most claims are processed within 1 day or less. The outside window is within 3 business days. Now, keep in mind, if you submit using, let's say, the mobile app, let's say you were in Walgreens or Target this morning and you purchased sunscreen, for example. If you snap a picture of that receipt and submit your claim through the mobile app this morning, more than likely that claim is processed and payment will go out the door tonight. And if you are signed up for direct deposit, so we can put that money into your bank account, it's going to hit your bank account at midnight tonight. It doesn't get much faster than that.
Actually, one correction there, Anita. The County of San Diego claims are reimbursed on a weekly basis. So the
that's right.
claim processing, is
Thank
very,
you.
very fast. But the reimbursements actually go out every Thursday. So
I got overexcited.
you did, but the claims processing is very, very fast. You get that.
Here's a person, they said they're sorry they arrived late. They have a question. By the way, Ivan, this presentation is going to be made available for you as well. But his question is if expenses for dental visits are eligible for reimbursement. And yes, they are. So from exams to x-rays, crowns, bridges, dentures, orthodontia, implants, all kinds of expenses are eligible. Nothing that's cosmetic. So no teeth whitening, for example, nothing that's cosmetic. This says, next question, do we have to file taxes for reimbursement received in a year? No, you don't. So you're not taxed on any of the dollars when they go into your healthcare or dependent care account, and you're not taxed on that money when it comes back out to you. So when you file your taxes on your form W-2, you are going to see, for those of you in dependent care, there is a box on the form, usually it's box 10, but that can change. That will show the amount of contributions that have gone into your dependent care account. And then in the taxable income box, it's going to show a reduced amount because you remember, you're not paying taxes on the healthcare money that you set aside into the healthcare account. So those dollars are not taxed. So that taxable income box is going to be a reduced amount to reflect that so that you don't have to pay taxes. How do I add additional documentation to an existing claim? If you have started to submit a claim online, so let's say you're in the middle of submitting a claim, you can pen that and then go back in and add to it later. If it's something that you've already submitted, you've completely submitted it, signed off on it, but you have something additional to submit, you can still submit that online or through the mobile app, and just make sure that you maybe put a note on it to let the processors know what it is you are actually doing. If I have an evaluation from my doctor, can I buy something ergonomic for my shoulder if they did not specify items recommended? So any of that type of equipment, you would need a letter of medical necessity from the attending physician. And there is a sample of a letter of medical necessity on the website. So again, under resources and forms, you can find that letter. So your attending physician needs to provide specific information as to what it is they're recommending and why. Oh, this person is talking about, it's important to mention if you order items from the FSA store, there's a shipping cost unless you spend $50 or more. Yes, that's true. I think the shipping costs can actually vary depending on where you are and how much you order. But if it exceeds $50, most times it is free shipping. And watch FSA store. They are like any other retailer. So whether you order from, you can order things online from Walgreens, you can order online from Walmart, like any retailer, there may be shipping costs associated with certain types of orders. I know FSA store offers special promotions during the latter part of the year where they offer free shipping on everything. And that's here and there, so it's few and far between. So and they offer a lot of products that are on sale. I know here this week they were offering buy one, get one. So I was lucky enough to get in on that. I know, let's see. I know that I can get reimbursed for my dental expenses, but can I get reimbursed for my husband's dental expenses if he is under my Delta Dental plan with the county. So yes, anything that is not already covered by an insurance plan, any of those out-of-pocket amounts, not only for your spouse, but your qualifying children as well, can be submitted through the healthcare FSA. So it includes your expenses as well as your spouse and children. If I had dental fillings, am I able to submit the treatment plan with the amount owed to file a claim? So fillings, typically that is a one-time service and fee. So depending on the date of service, so if that happened, this year, you certainly can go ahead and submit that claim. And if you have a balance, it can be considered. Now, if that is an old bill from a couple of years ago, then no. So remember, expenses need to be incurred during the plan year. Who do I contact at the FSA store when an item has not been received and the funds have already been deducted? I would go to fsastore.com and click for customer service or contact us. I don't know a specific individual, but like any retailer, they have people there that can assist. I also know that FSA Store has a great chat feature. So if you just go to their website, chances are that chat box may pop up and they might be able to help you there as well pretty quickly. Keep in mind, FSA Store is an independent entity. We don't own them. We don't, they're their own company, so to speak. The reason we promote them is they have a wonderful website. Like Katie said earlier, you don't have to make purchases there, but it's a great resource to find out the things that are eligible. And then you can go buy locally wherever you choose to shop. They also have some great educational content. So they have an extensive listing of eligible expenses as well, and lots of just good consumer type information that's very helpful. Oh, how do we claim mileage for reimbursement? So all you have to do, there's a couple of ways. If you do it on the mobile app, there is now a feature on the app where you can just simply plug in information, the dates that you traveled, where you traveled to, the number of miles, and we'll automatically calculate that for you. I think the reimbursement now is 17 cents per mile. Or you can do a claim form and you just simply itemize your trips, say where you went to seek what type of care, was it medical, dental, whatever it was, the provider's name, the miles that you traveled, and then you calculate that by the 17 cents and submit that. Is the treatment plan an acceptable document for claims? This may be referring to dental. Typically, when I hear treatment plan, I think of orthodontics. So if this question is related to orthodontics and you have a contract agreement with your orthodontist, certainly you can submit that as part of your documentation to be reimbursed for those monthly payments.
If it's a pre-treatment plan to where your dentist has given you what it's going to cost for a future expense, you would not be able to submit that for reimbursement because the expenses have to have been incurred with a date of service before you can submit that for reimbursement.
Good point. Thanks, Katie. Should a letter of medical necessity be submitted only one time or should it renew every year? That should be submitted each year. Typically with those types of treatment, it's not something that goes on forever and ever. So it's usually a limited period of time. So if it does fall into a new plan year, you would want to get that letter updated then. Christine has a question here. I'm not sure I quite understand it. You might want to give us a little bit more around your question regarding spending account process. how are the claims different than providing itemized receipts? Or is that the same process? I'll take a stab at this. So I think we're talking about the same process. So to be reimbursed from your account, you need to submit a claim. And so that claim includes a completed claim form plus documentation of what you have incurred as an expense. So that would be the itemized provider statement or the insurance plan explanation of benefits, or it might include an over-the-counter receipt for over-the-counter products. So it's kind of all one and the same. A claim is the form with your backup documentation. Another person said, do we need to provide gas receipts? No, because gas is not an eligible expenses. So it is only the mileage at 17 cents per mile. So not actual gas receipts.
And the mileage, one thing to add to that, you can calculate from your home to the medical provider and then back to your home. So you can do the round trip calculation on how many miles it is to go to that medical provider as well.
You know, and that includes not just your doctor's office, but whenever you go to and from the dental office, if you're going to and from your eye doctor's office, if you're going to pick up a prescription to and from the pharmacy, all those kinds of mileage reimbursement. You know, you get toward the end of the year, those can kind of help you out if you have a balance sitting there, especially if it's over that 550. Let's see, I might have one more. Oh, Jessica said she's on the website. She's not able to find the mileage claim form. It is just the regular healthcare FSA claim form. And you would enter in information under the healthcare section of that claim form. So there's not a separate form for mileage. It's just under that healthcare claim form. And we have an image that we could probably share. We could even insert it into this presentation perhaps before Nidra posts it, if that would help. For mileage, is there a mapping system we need to use like Google Maps or MapQuest? No, you're just on the honor system. You just tell us you went to Dr. Joe Smith's office. It was 20 miles round trip. It went on this date and it was for my annual checkup, and then calculate it and you're good to go. So you really don't need any backup documentation for that mileage. I think that's it. Unless there are any other questions, we're happy to take those. Oh, here we go. If we have a balance over $550, can we go on the ASI store and use our balance? Yes, ma'am, you sure can.
The FSA store also has really nice bundles. So if you run into that situation where you may lose $500 at the end of the year, you can go and take a look at those eligible over-the-counter bundles, which are usually quite pricey, and use up the money that way with things that you know you are going to be using.
And keep in mind, FSA store does have, I just looked this week because I need some face masks, because moving into this time of year, I always think of October, okay, I need to get my flu shot. I need to, you know, stock up on my personal vitamin C. That's not eligible, but just all these things I'm starting to think about. I noticed that FSA store has face masks. They also have pediatric or children masks that are available now. They have the at-home COVID testing kit. So, you know, in addition to lots of their lip balms and sunscreen that I like, I especially like their sunscreen that is tinted because I use it as a makeup throughout the year. Just some personal tips for you that are helpful to me. For mileage, do I need to attach doctor appointment paperwork? No, you don't. Just tell us on the claim form the date you traveled, where you traveled to, for what the service was, and then calculate your, you know, tell us the mileage round trip, and then calculate it and submit it, Just to confirm, if I have a balance of 550 by 12/31/2020, I can submit claims until March 31 of 2022.
Yes, that is correct.
And Josephine, I hope we got your question answered. So someone asked, can you demonstrate submitting a mileage claim? I'm in my account and I can't figure it out. So online, there is not a mileage calculator. So in the freeform boxes, you would just simply, where it says to file a claim or submit a claim, in the freeform boxes, you would just fill in the information and you would have to tell us it's mileage on this date to Dr. Smith's office, what it's for, and then you will have to calculate the dollar amount based on your mileage. Under the mobile app, if you go into the app and you put in the miles, it will calculate that for you. We could probably add perhaps a screenshot and maybe do an example and stick it in here. I'll make a note to do that. I think we have another question. Can we submit mileage in the same claim form provided in the app? Yes, you should be able to do that. Yes, do we enter mileage in the expense description? Yes, that's just exactly right. I think because of a lot of the questions with mileage, I think we will try and do a couple of extra slides on that. I think that might be helpful for people. And I don't see any other questions.
All right. Well, if there are no other questions, thank you so much for having Anita and I today to do this. And I believe this will be posted somewhere for you to review if you would like to rewatch it.
That is correct. Thank you, Katie and Anita. Thanks everyone for attending today. This will conclude the webinar. Have a great rest of the day.